Early treatment of heart attacks can save lives, but some of the symptoms of a heart attack can be confused for less serious problems. In today's Heart of the Matter, we take a closer look at recognizing the signs of a heart attack.
Someone, somewhere, suffers a heart attack every 34 seconds. For women, the signs can be subtle: shortness of breath, pain in the arms, back, neck, jaw, or stomach. But many women discount the possibility that heart disease could be a problem. And that, say doctors, is a big mistake.
It's actually the #1 killer of women. And if you actually look at the number of women who die from all causes combined, cardiac disease is the #1 killer, and it really kills more women than all other cancers combined, which is pretty impressive and surprising for most people.
It's never too early for women to think about their risk of heart disease. For women in their 20s, they should know that family members with heart disease are a risk factor.
As the decades kind of go on, we start looking at things a little more closely and combining that with other diseases. Whether or not you have diabetes, for instance, is an important risk factor and an important way to think about your risk for heart disease.
In their 30s, they should know that long-term stress can cause increases in heart rate that can damage arteries. Some types of birth control can raise blood pressure.
They should probably once yearly have a cholesterol check. They should absolutely have a once yearly blood pressure check. And then once you start reaching the age of maybe 40 or even 50, things like an EKG screening at your primary care physician's office also become part of the mix.
And it's important to keep a closer eye on your health over the age of 60, because age counts as an additional risk factor. Regular visits to primary care doctors can catch early signs. If there are problems, cardiologists can provide treatment.
But we can do a lot, and there are a huge battery of tests that we can run, typically starting with the least invasive tests, and things like stress tests and ultrasounds of the heart are things that we do to tell how high-risk patients are.
By knowing how to recognize the signs of heart disease throughout life, women stand a better chance of avoiding risks of heart attacks and other problems. For Smart Medicine, I'm Teeley Starnes.